Natural and home remedies for traumatic brain injury. Aside from team rivalries and all-out victories, brain injuries are one of the hottest topics in sports today. According to the American Association of Neurological Surgeons, sports and recreational activities alone are responsible for nearly 21% of brain injuries. No matter how you have developed an injury, though, you can employ a number of different methods to treat the condition, incorporating necessary medical attention as well as natural cures like omega-3 fats and turmeric. Brain injury. Mayo Clinic explains a brain injury, or traumatic brain injury, TBI, as a condition that occurs when an external force causes brain dysfunction. The most common causes of TBI are a violent blow to your head or a jolt to your head and/or body. An object permeating the surface of your skull can also cause significant brain injury. The prevalence of symptoms associated with a brain injury vary depending on the severity of your condition. Additionally, some symptoms may occur directly following the event or not manifest until days or even weeks later. Nevertheless, common signs of a brain injury include loss of consciousness, headache, nausea, vomiting, fatigue, difficulty sleeping, and dizziness. Other symptoms include sensory issues such as blurred vision, sensitivity to light or sound, memory or concentration problems, and mood changes. Do natural cures help recovery from a traumatic brain injury? It is absolutely necessary to consult a medical professional when you suspect a traumatic brain injury. However, there are many natural remedies that help expedite recovery from a brain injury. Herbal remedies that offer support for TBI include options such as omega-3 fats, turmeric, and ginkgo. Likewise, treatments such as acupuncture and massage have also shown to be beneficial for treating brain injuries. Omega-3 fats. When you consider the composition of your brain, it is actually 60% fat, constructed from omega-3 fats. A daily supplement of omega-3s inhibits cell death, helps promote the reconnection of damaged neurons in the brain, and activates specific genes that help you cope with brain damage. Dr. Mercola suggests 2 to 3 500 mg capsules of krill oil, a natural omega-3 fat, each day for the best benefits. Turmeric. The Vermont Center for Integrative Herbalism supports use of turmeric as a natural treatment for brain injury. Turmeric contains an important compound known as curcumin, which is used for relieving inflammation in the system. It also helps promote the functioning of the brain and promotes effective blood flow throughout your body to ensure you are getting plenty of oxygen flow to your brain. For the best results, take a 500 mg capsule of turmeric up to 4 times a day. Ginkgo. Ginkgo biloba is another treatment option purported by the Vermont Center. This treatment contains glycosylated flavonoids that help reduce inflammation in your brain following an injury. This treatment also promotes circulation to the brain and improves moods. Take 240 mg to 480 mg of the extract daily. Acupuncture. The Brain Injury Recovery Network also suggests alternative therapies, like acupuncture for effective treatment. With a focus on rebalancing your body, acupuncture may help treat your symptoms as well as the actual damage to your brain. Massage. While massage may not seem like a directly related treatment for TBI, it helps restore proper function throughout your body. It also helps improve circulation, the flow of lymph fluid, and the metabolism of wastes in your body, which all work to rejuvenate your brain. Try one of our suggested natural cures for a brain injury, or read below for even more reader-suggested treatment options. Treatment for traumatic brain injury, TBI, or intracranial injury. Treatment of traumatic brain injury, TBI, or intracranial injury completely depends on the severity of the injury. Treatment for traumatic brain injury, TBI, or intracranial injury. Treatment of mild traumatic brain injury, TBI, or intracranial injury. All that is required is enough rest and some pain relievers. Nevertheless, The patient should be monitored at all times to ensure that there are no developments of new symptoms or that present symptoms are not worsening. The person may have to visit the doctor occasionally for checkups and to certify the person able and ready to resume all personal activities. During recuperation and immediately after, the person should avoid physical activities or thinking-related activities, and progressively, he/she will resume a normal life. Moderate to severe traumatic brain injury, TBI, or intracranial injury. Moderate or severe traumatic brain injury, TBI, or intracranial injury requires emergency response treatment. The first thing to do in emergency situations is to make sure the patient is adequately supplied with blood and oxygen, and that the blood pressure is normalized. This is to prevent further complications. More emergency treatments may be provided in the intensive care rooms if the person has any inflammations, lost too much blood or low supply of oxygen. Medications for treating severe traumatic brain injury, TBI, or intracranial injury. After serious conditions of traumatic brain injury, TBI, or intracranial injury have been normalized or brought under control, the doctor can now offer medications based on the tests previously carried out. This is to prevent further worsening of secondary symptoms. Treatments required include anti-seizure drugs. A week after the injury, patients who have severe traumatic brain injury, TBI, or intracranial injury may occasionally experience some seizures. Giving them some seizure drugs will reduce any complications that may arise. Diuretics for treating traumatic brain injury, TBI, or intracranial injury. These are intravenous injections that help reduce the quantity of liquid in the tissues by increasing output of urine, so that the pressure in the brain is minimized. Drugs that induce coma, when blood vessels are not able to provide the right amount of oxygen and nutrients to the brain. The patient with severe traumatic brain injury, TBI, or intracranial injury can be given some drugs that will put the person into a temporary coma, since people in coma do not use much oxygen. Surgery to treat severe traumatic brain injury, TBI, or intracranial injury. The doctor may also have to carry out some surgery during or after emergency treatments for severe traumatic brain injury, TBI, or intracranial injury. Surgeries may be done if there is blood clotting in or outside the brain as a result of bleeding. If this is not removed, it may pressurize the brain and destroy brain tissues. A surgery may also be carried for traumatic brain injury, TBI, or intracranial injury out to open a window that will discharge cerebral spinal fluids that may have accumulated in the brain, to prevent further swelling and reduce pressure in the brain. Additionally, surgery may be done for severe traumatic brain injury, TBI, or intracranial injury to repair fractures in the skull or remove pieces of broken skull from the brain. Natural remedies for traumatic brain injury, TBI, or intracranial injury. There are a number of natural remedies for traumatic brain injury, TBI, or intracranial injury you can take to help you recover faster while going through with your therapy. These natural remedies include ginkgo biloba as a natural remedy for traumatic brain injury, TBI, or intracranial injury. The Vermont Center supports the use of this herbal extract for treatment of traumatic brain injury, TBI, or intracranial injury symptoms. It contains some glycosylated flavonoids, which help to reduce any brain inflammation, increase blood circulation in the brain, and improve mood. Daily intake of 240 to 480 milligrams of ginkgo will be required. Omega-3 fats as a natural remedy for traumatic brain injury, TBI, or intracranial injury. The brain comprises of 60% fat from omega-3. Omega-3 helps prevent the death of brain cells, reconnect damaged neurons and trigger the production of genes that can help manage the symptoms. According to doctors, for best results, take 500 milligrams of omega-3, 2 to 3 times daily. Turmeric as a natural remedy for traumatic brain injury, TBI, or intracranial injury. Turmeric was approved for herbal treatment of brain injuries. It contains cumin and other components that help to reduce inflammation in the brain, improve better brain functions and encourage easy flow of blood and oxygen in the brain and body. 500 milligrams of turmeric capsule 4 times daily will yield good results. Another natural way to manage traumatic brain injury, TBI, or intracranial injury is through massage. It is very important for the patient to massage the affected part of the body. This will relax the body and increase blood circulation and liquid flow in the body. It will help your body to function properly. Acupuncture can act as a natural remedy for traumatic brain injury, TBI, or intracranial injury. Therapies like acupuncture are also recommended for integrative herbalism. The pins can drive sensations to your cells, nerves, and sensory organs to relax and relieves pains, anxiety, migraine and depression. What are the risk factors in traumatic brain injury, TBI, or intracranial injury? The following include those factors that can increase the tendencies of having a traumatic brain injury, TBI, or intracranial injury. Youths between the ages of 15 and 24 who often engage in outdoor sporting activities, are at the most risk for traumatic brain injury, TBI, or intracranial injury. Young children below 4 years of age who are still tender and most often fall easily. Risk factors for traumatic brain injury, TBI, or intracranial injury are more for older adults above 75 years. Involvement in motor accident, soldiers engaged in battle, being physically abused. Previous head injury experience is a risk factor for traumatic brain injury, TBI, or intracranial injury.